Psoriasis is autoimmune skin condition which affects around 2% of world population. Main idea of psoriasis is accelerated buildup of skin cells or accelerated growth of skin cells. That's psoriasis, and it causes inflamed red patches covered with silvery scales, commonly known as plaques. That's psoriasis. So idea of psoriasis is accelerated growth of skin cells, and you can see here it very clearly. You can see how thick is skin cell layers in case of psoriasis and how thin is in case of normal skin. You can see this difference. So what is the mechanism of action? How psoriasis is developed? Main component of psoriasis pathophysiology is hyperactive T cells. This T cell activates immune system and it causes rapid production of skin cells, production and proliferation of blood vessel and inflammation. These red patches can be itchy and sometimes it's painful also. Most common sites of psoriasis is scalp, elbows, lower back, especially knees, and rare manifestation of psoriasis is facial and genital manifestation. We have several types, more specifically 5 types of psoriasis. First and most common type is plaque psoriasis. Plaque psoriasis occurs 90% of cases, and it also called as psoriasis vulgaris. It causes dry, raised, scaly patches, usually on elbows, on knees and lower back, and they are covered with silvery scales. Silvery scales is important in case of plaque psoriasis. It accounts around 90% of cases. It means if person has psoriasis, in 90% of probability it's plaque psoriasis. It's most milder form of psoriasis and prognosis is best compared to other types of psoriasis. Another type of psoriasis is guttate psoriasis. Guttate psoriasis accounts around 10% of psoriasis cases. We can remember guttate psoriasis as it occurs usually among young adults, and it has drop shapes. This lesion shape looks like drop. That's why it is called guttate psoriasis. And guttate psoriasis can be triggered by streptococcal infection. And usually guttate psoriasis have also good prognosis, or it can revolve into plaque psoriasis. So guttate psoriasis has 2 resolutions. One is resolve itself, for example, and another is revolve into plaque psoriasis. It's possible. Third type of psoriasis is inverse psoriasis. Inverse psoriasis is different because here we have red patches and it's inflamed and it looks like raw meat. Inverse psoriasis usually occurs in armpits, groin, under the breast, around the genitals and buttocks, and it accounts around 3% of psoriasis cases. So inverse psoriasis already rare. Another form is pustular psoriasis. In case of pustular psoriasis, we have blisters which are non-infectious, and there is pus, but it's not infectious type. You can see here. Usually pustular psoriasis develops on hands and feet, but it's rare also. It occurs around 3% of cases. And erythrodermic psoriasis, rarest form of psoriasis, but most severe form of psoriasis. It causes widespread lesion of skin, fiery skin. So skin lesion is very widespread, and it's difficult for people who have this disease. It can cause serious depression, also poor regulation problems. And it's erythrodermic psoriasis is difficult to manage. That's important. And now let's say what is course of the disease. Course of the disease is flaring ups and remission. It's cyclic type. So we have flaring up, then remission, then flaring up again, then remission again. So we have cycle here. And these flaring up periods usually last several weeks, sometimes months. And remission, sometimes remission is very long, and sometimes it's lifetime also, but sometimes flare-ups returns again. Psoriasis is important also because it increases risk of other disease. For example, psoriasis arthritis, heart disease, hypertension, diabetes, and depression. So psoriasis increased risk of heart disease. That's why it's important. So it's independent risk also, and hypertension, diabetes, and depression, because such symptoms is very deliberating for people, and it can cause depression. And what is the treatment? First line treatment is steroids. Usually it's topical creams, steroids, vitamin D analogs, retinoids, and coal-tar, or phototherapy, also UVB light, is effective. Second line treatment usually is systemic medication such as methotrexate, cyclosporin, retinoids sometimes, and biologic therapy. Biologic therapy, for example, tumor necrosis factor inhibitors. Biologic therapy really effective, but it has important side effects. So such treatments, such systemic treatments, always are kept for conditions when first line treatment is not effective. And first line treatment, again, vitamin D analogs, retinoids, UVB light therapy, coal-tar, that's first line treatment. That's all we should know about psoriasis. Psoriasis have 5 forms. Most common is plaque psoriasis, and it's dry, raised red skin patch covered with silvery scales, and it has flaring ups and remission. Second most common type is guttate psoriasis, and it accounts around 10%. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.